Hello, and welcome to the Extraordinary Health Podcast with your host, Dr. Paul Bekkum, and with myself, Dr. Victoria Lau.
Hello.
Hi there. That's it for us today again. But today, we are talking about the benefits of high-intensity laser therapy for muscle soreness. So
That's a lot of words to say for, that's kind of like a word salad. No.
it is.
Yeah, I mean, high intensity laser therapy, like we have a class 4 K laser therapy in the office. Actually, we have two. One is a 20 watt laser. I've had that one for 8-9 years, I want to say. Actually, probably even a little bit longer than that. And we just recently, in December, got their new laser, the Special, that is a 100 watt laser, which is awesome for us and for patients because we can get the same therapy done in 80% less time. So it's an amazing piece of therapy to have, and especially for like muscle soreness. I can probably discuss even what Dr. Roundtree from the Laser Therapy Institute, for which we're a part of, had discussed in some studies that were regarding testing athletes to use lasers to help deal with muscle soreness. And the kind of very brief aspect of it here is they, with one group, applied laser therapy before they exercised, as well as another group, they did laser therapy after they exercised. And what they kind of found with the laser therapy group that got treated before they worked out, they actually had much less soreness, but they also were able to do more reps and also gained a little bit more muscle mass. And kind of the theory around that is that, hey, the laser helps to improve blood flow to the area there. It also helps to stimulate the mitochondria of the cells to produce more energy so that when you are working out, you're literally using as much energy as you possibly can in the muscles there to be able to help them function for a longer period of time, thus giving you a little bit better workout. When you have better blood flow, you're getting more nutrients to the muscles so they can grow. And, it's just a very good positive cycle there. So, but a lot of times people don't come into our office to have laser therapy done before they work out.
No, it's usually after.
It's usually, yes, they went and worked out, and all of a sudden they're just like, oh my goodness, I hit the wall here, and I think I overdid it. I mean, probably almost everybody that starts an exercise program right away, you're always going to get that exercise-induced, muscle soreness, probably within the first 24 to 48 hours of working out. And laser therapy could be one of those things that helps you, get over that hump and helps you just feel a bit better there. I mean, typically we would see a pain reduction of around 50%. I always tell people probably 40 to 60 is the normal range that I see. But the nice part about laser therapy is you can even apply it multiple times a day. I mean, it might get to be a bit overkill. A couple times a day would probably be good. But, if you wanted to do it probably every hour on the hour, we could probably do that as well. If you had, some soreness that you wanted to get over because you had a competition to be in or something like that, we can just keep working on it there. But you do need to give it a little bit of a break in between treatment sessions there too. So,
Wow, that's pretty neat and interesting. Now, we talked about a person coming in and using it before and after an athletic exercise or things like that. How would this work? Say for your everyday dad, weekend warrior, going out doing an activity and maybe straining something. Would that be fairly similar? Would it be more of a treatment recommendation protocol?
I mean, in general, it's going to be very, very similar. I mean, anytime that you've gone and worked on a muscle and strained it, you're kind of definitely micro tearing it. Some people might get bigger tears too, but if they get too big or you've torn a tendon off, I mean, then we're going to be sending you to probably get that surgically reattached. But that's a very infrequent thing that can happen. But say you're out mowing your lawn, and first time of the year, and you're bagging up all the grass off the lawn, and getting some heavy lawn bags, you're lifting and, bending, lifting, twisting, and you actually, strain the muscles there. I mean, typically, even with the athletes too, we're going to get them in the office. We're going to try and find out exactly what's the cause of their problem, because we don't want to just treat the symptoms, because then as soon as the symptoms go away, it's not that the problem disappeared, it's just that the pain went away. And if you just are covering up the pain, you're going to have the problem come back again. It's not a matter of if it's going to come back, it's probably a matter of when it's going to come back. And it might not come back tomorrow, the next day, 3 weeks from now. It might come back 2 years from now, 3 years from now. And, here you have, some scar tissue that's developed, from the injury that you had. But getting back to the treatment of it here is, we initially just want to assess the person, kind of find out exactly where they're at, so that we can give them an accurate treatment plan, so they know exactly what to kind of plan for, and, they get to decide how they want to move forward. They can treat it for just the pain relief if they wish, or we can literally look at, hey, treating the whole underlying cause of the problem, which is probably going to entail more than just the laser therapy. It's probably going to entail some different therapies, including maybe some chiropractic work, some soft tissue work, other modalities we have in the office, probably even some rehab as well, so that we can strengthen up some muscular imbalances that were probably there that you just never realized you had.
Perfect. Now, going into, say you come in for a treatment with just the laser, what are you feeling with that? What's a patient feeling?
What's a patient feeling? I mean, with the new laser, you might feel a little bit of warmth with it, but it's more a velvety warmth is probably the way to describe it. And again, the lasers that we have, they're not cutting lasers. They're not like a surgical laser. The lasers you see that get used in automobile manufacturing and different things like that, where they're cutting things out. This is a therapeutic laser that helps to stimulate your body to basically heal itself. So you don't necessarily need to feel the heat, and it just depends on the kind of protocol that we use with a laser. There's different frequencies that the laser can be run at. There's different times that it's on and off, but it's all set for different, we have 7 or 8 dozen different protocols that we can use depending on what a person has going on. So could range from the muscle soreness there to, like this time of year, sinusitis or something like that. So we have, some programs where we can help deal with the pain and inflammation due to your sinuses getting aggravated. But they don't have to feel that. You're definitely going to see the light from the therapy there. And we have special, really cool goggles you get to wear while we're running this, so that we don't get some reflection of the laser that gets up into your eyes. It's somewhat imperceptible, but I think the most thing that's perceived by the person is that once we're done running the laser, you should feel some pain relief. It takes maybe about 15 minutes to really kind of get that peak kind of pain relief kind of effect. And like I say, usually you're seeing about a 40 to 60% pain reduction. And then, up to about 2 hours is really kind of the peak effect of the laser there. So most people might even gain even a little bit more pain reduction. But it's also the tissue healing that kind of is going on with it as well, because, there's basically, it's, like with our neuropathy patients, so even past the muscle soreness. So it even helps regrow nerves, regrow some blood vessels there, helps stimulate blood flow, helps stimulate the cells to kind of speed up the mitochondria of the cells almost by like 16 times. On a typical resting state of a cell, it'll produce 2 ATP. Whereas, when you stimulate it with a laser, it's going to go up to 32 ATP. So you just have that much more energy available for your body to heal itself up and just recuperate from any injuries that might have happened.
Perfect. So it's not like, in comparison, you wouldn't compare it to, say, like ultrasound, where you're actually feeling the movement of the head, you're in the warmth. It's more just kind of a passive, you just have that warmth across your body as it's going there. Or if you'd feel the warmth or not.
And you can even do it or use it during somebody doing some active therapies. So they could be doing some exercises, and we could have you doing some squats, and we could maybe even be running the laser over your back as you're going through some of that motion. We might have you stop in the areas where you'd feel pain, whatever joint we might be working with there, or muscle, so that we can deal with, that sore muscle wherever it happens to be out there, and try and get it so that it does function properly through that full range of motion, and that you can use the muscle afterwards as well through that full range of motion. So, usually the laser is getting combined with some chiropractic work. So not only adjusting the spine, like in our office, we're going to look at your whole skeletal frame. And if you have something off, I guess typically one of the big things I look at was shoulder soreness. Could be just a person that's even has a desk job. They're just using a mouse and a keyboard, and their shoulders are getting sore, because they're sitting there all day long. Well, a lot of them have some misalignments of the shoulder blade, the collarbone, and we want to get those adjusted. And people know immediately, right away after we get them adjusted, that yes, it's better. You should see, we'll look for what I would call inhibited muscles. Most people think they have maybe a weak muscle and they need to go to the gym or something. And that's really not the case. It's more the case that, like I say, the muscle's inhibited. Something's irritated, and we need to figure out what that problem is. The laser can be very helpful with that as well. So if you have that sore muscle, say it's, I guess the big thing I always see with shoulders is probably more like their lat muscle. So not only could we get the shoulder blade adjusted so we can get the proper alignment back, but run that laser right over that lat muscle there to activate that muscle, decrease any soreness in it, increase the blood flow to that tissue there so that it can function normally. But then we're also giving them some exercises to help to strengthen, that lat muscle to help stabilize the shoulder blades and all that as well. So
perfect. Now, you mentioned that there is quite a few different settings or different ways of utilizing the laser. And, besides like a sore muscle, you mentioned sinusitis. What are some typical, whether it be an issue that a patient comes in with or a recommendation that you use the settings with? Like, say, knee pain, or is there anything else specific?
Basically, in our office, we deal with a lot of what are called neuromusculoskeletal problems. So problems that are related to your nerves, your muscles and tendons, as well as like your bones and joints. And really the laser is good for almost all of those where you have any kind of pain or inflammation going on. So that could be, yes, a sore muscle. It could be a tendinopathy, so it could be like a tendinitis where it's an acute thing. Baseball pitchers or a baseball player can get a tendinitis, especially in their rotator cuff muscles. It could be a tendinosis, which would be somebody who's chronically aggravating something. I guess I start to think of carpenters or something like that, where they're using a hammer or a tool in certain ways, and they end up just chronically straining, some of their forearm musculature. And the laser works fantastic to just get better blood flow, break that tissue up. We're probably going to do some other therapies to help break up any scar tissue that's in there, but then the laser is super helpful at knocking down, any kind of pain or discomfort that's associated with that, where most people walk out of here and there's no pain, but they have, the proper structural alignment of everything and the proper function of it. It's just a matter of how long does that last in between times here. You can think of carpal tunnel syndrome even. That's one of the main things that the laser was actually cleared by the FDA initially for it to be utilized as a therapy in the United States. Now is like right around the year 2000. Any repetitive stress injury like a carpal tunnel syndrome is good because you're just aggravating, muscles, tendons, the fascia, the bones and the joints there. Rheumatoid arthritis. We got patients with rheumatoid arthritis. When you have that flare-up of arthritis, the laser is non-invasive. It's not going to hurt anything. It just helps to decrease the pain, decrease the inflammation, and it can be a significant relief for people that do have rheumatoid arthritis and allowing them to start to function a little bit better. And then once their arthritis kind of slows down, kind of regresses there a little bit, and they kind of go a little bit into remission, and then we can start to work with trying to get the proper alignment of those bones and joints again. So hopefully, they don't have a flare up again, but that's an autoimmune disease, so you just never really know sometimes.
Mm-hmm. Great. Now, with all these conditions, is there anything, any contraindications to using the laser?
I mean, again, I've had some patients with different things. Usually it's like implanted electronic devices. We can run it over joint replacements. We can run it over, I guess we can use it on, I should say, we can use it on like pregnant patients, but we just don't want to be running it over, where the fetus is there, just out of precaution. I mean, there should be no issues there, but we just don't want to run it there just to be safe. But running it over things like a pacemaker, we can run it over there, but I've talked with the, I'm trying to think of the pacemaker company, Medtronics. I've talked with some of the technicians there because I had a patient that was just concerned about it. And he basically said, as long as you keep the power unit away, you're good. Because I had to run on his shoulder, and it was, close to where he had his pacemaker implanted. And he said that was perfectly fine. We just don't want to be putting the power unit next to his pacemaker there and causing issues that way. Implanted, like TENS units, muscle, nerve stimulators that people can have in there. Implanted devices like for sleep apnea. If there's an active tumor, cancer tumor, that would be another thing that, we don't want to run it over there. We don't want to be giving energy to something that's kind of out of control as it is anyway here. So, but that's about it. There's really no known side effects to the laser, as well as every other, physical medicine kind of modality we have in the office as well. There's really no known side effects to them. So, I mean, it's safer than even taking, medication. So,
Yeah, because some of those medications certainly can have their side effects. That's awesome. So, unless you're fully electronic, you can come in and utilize the laser.
If you're a robot, it's probably not for you.
So what have some examples? Have you worked specifically with, say, an athlete on a specific syndrome or condition that's been going on in the office here, and have something to let us know exactly like how they've been doing and what you saw with the treatment of the laser?
Like some of it is, like medial epicondylitis, lateral epicondylitis. You see that a lot with, obviously, golfers, tennis players, some volleyball players, baseball players, usually the throwing types of sports. I usually work with crazy people like rodeos, so who knows what they're doing, gripping onto things really tightly. So literally it's those tendinopathies, where they're getting some basically tears in the muscle, from the sport that they're performing. And again, typically it just really depends on the severity of it when somebody comes in as to, how much of the treatment do they really need to help, resolve their problem. And again, that's what we usually try and figure out on that initial consultation. And if it seems really severe, I might just tell them, hey, we're going to have to treat you for a little while here and see how it goes before we move forward with a kind of formal treatment plan. But I would say 98, 99% of people, we should be able to give them a pretty good picture of what's going on. There's those few patients that come in, I guess an example, not an athlete, but a person who we're treating for or wanted to come in for neuropathy, and we use the laser and all that for it, but they had a condition going on that's like, hey, we need to get this cleared up first before we even think about, treating the neuropathy, because, yeah, you're already on the severe end of the spectrum, and we need to get this healed. And the laser works fantastic with it. They're actually, I can't really comment too much right now because they're right in the middle of their treatment. They're just maybe a little over a week into it right now, and we're going to see how they respond. It looks to be favorable already, but we'll see what happens as the treatment progresses there. We've used the laser a lot on rotator cuff issues for people, just to decrease the inflammation, AC joint sprains, strains, like biceps muscle strains. Some of the football players with that. The rodeo people, it's hips. A lot of them just from riding. I mean, a lot of the gals around the team, it's literally riding. They're getting a lot of stress and strain on their hip muscles, especially it's called your TFL, muscle in your hip, even down into the thigh then, more like an IT band kind of a syndrome. Hip bursitis respond really well to it. Usually we're probably going to combine another therapy with it as well to help get rid of that inflammation, our focus shock wave, which we should probably have another podcast on that to help explain that to people a little bit more too. But there's just interesting things like shingles. I think that's probably something that in the past, we've typically used something like a therapeutic ultrasound because you're heating the tissue up with the ultrasound there. That can help that shingles episode diminish or just shorten by using that therapy on there and decrease the pain that the person's feeling. The laser's kind of nice because we don't even really have to touch the tissue. We'll keep it very, very close. But that helps to kind of kill off the virus there and decrease the pain, decrease the inflammation that's going on, and help you get over that episode of shingles faster. So
many, many usages. Now, you mentioned, of course, there's different protocols for different things that a patient is coming in for. How long is a typical just treatment of laser for, say, just a muscle soreness?
Like muscle soreness? I mean, typically, in the past, it might be, with our 20-watt laser, it might be about an 8 or 10-minute treatment, but now it's literally 80% less. So it's like a minute and a half to 2 minutes to get it treated. It doesn't take very long at all with the new 100-watt laser there. It's pretty much you come in and then you can even feel what it feels like right after we're done. You kind of want to call it the magic wand sometimes. So,
so safe, effective, non-invasive, and a time saver.
Yeah, definitely. Especially, I'm amazed at just how fast we can get things done. I mean, not only the muscle soreness type things that we're talking about here today, but with some of our other conditions, it would take up to an hour to do some of the different treatments. With our previous laser, it's 12 minutes now. And there's just, it makes it convenient and more effective for people because patients can follow through with that. They don't have to be in the office forever here getting treated. That's a long time to just be either sitting there or lying there to have a treatment done. And that's the big thing with other lasers that are out there too. I mean, with some of the treatments we do, it's to help out nerves and all that. The new laser we have, it gets so much, it's joules of energy that we're looking at putting in there. And it pumps it out so fast that, like I say, you're done in, roughly 12 minutes there. Most other lasers that I've looked at compared to the one that we have, a minimum you'd be in there for 60 minutes, if not longer, to get the same treatment. And even home equipment to get the same treatment with, like a home laser therapy or LED therapy to get what we have with our laser here. You'd have to wear the dang things like all day long. For sure, a few hours. You're going to have to watch a movie every time you do therapy. And then for a lot of people, that's the exact opposite of what you should be doing. You should literally be up and around moving to help with blood flow, not just sitting there watching some kind of movie or something like that. So
no rest for the wicked.
No, when you have the treatments that can get it done in a fairly quick period of time with no side effects, I think that's probably what people need to understand. It's like, it's safe, it's effective, no side effects known with it at all, and you can kind of get on with your life, once we get everything treated. So,
and is there a specific, amount of time, amount of treatments that are recommended for like a sore muscle, or is that more determined upon, as the patient goes on and what they're seeing and feeling?
It's usually the severity of the condition. Usually if people are kind of, mild, moderate, up to moderate, severe, we can give them a pretty good idea of what it's going to take. It's those people that are on that severe to extreme end of the spectrum where, okay, we're going to have to treat you for a little while here. And we do periodic re-exams with people, typically on a monthly basis here, just to see where they're at. But, once we kind of have a better idea after things have kind of calmed down, I would say most people are going to know within the first 2 weeks. So usually it's kind of like a 2-week trial. Let's see where we're at there, see if we can give you a little bit clearer picture of what it's going to take to get this condition resolved for you. So
beautiful. Well, that's quite a bit of information on our wonderful Class 4K laser. If you have not or would like to subscribe to our scheduled emails, you can always get more information on everything we talk about in the podcast that would be sent directly to you. Anything else you'd like to add, Dr. Bekkum, today?
I think that's probably just a lot of information for people there. I mean, obviously, if you guys have some feedback, you want to hear some more information, whether that be, on the Class 4 laser there, or some of the other therapies we have in the office, like our pulsed electromagnetic field therapy, or PEMF therapy, or focused shockwave therapy, or anything else that, we've kind of mentioned in podcasts here. You want to know some more stuff about functional medicine, please, email us, make comments on the podcast here so that we can make sure that we're getting you the information that you're looking for so that you can make some informed decisions as to different treatments that are out there. I mean, so many people feel stuck, because they've been taking certain medications for a long period of time. They think that they just have to keep doing that. And, there might be some other alternatives here that we can offer you that might get you off the hamster wheel of the medications there and, get your body to finally feel good and work at its full potential. So,
yes, we have quite a bit of information available, and that can be given to you in multiple fashions, and then you can make the informed decision and choice on your own care. Sound about right?
Yeah. Well, I hope that was informative for all of you, and we'll see you next week.
Yes, thank you for listening in, and continue to follow us at the Extraordinary Health Podcast on your favorite streaming services.